Hello, and welcome to another episode of the Heart Centered Therapist podcast. I'm so glad you're here. I'm Cindy Gozanski, your host. Today, I'm bringing a really great guest, and I can't wait for you to meet her. We are going to get to hear from Dr. Rita Gupta. Dr. Rita is an integrative family physician. She is double board certified in integrative medicine and family medicine through the ABFM. She's gone from the traditional route of practicing primary family care for 20 years, and now she is moving into more of an integrative approach. Dr. Rita Gupta is an expert in pain pre-processing, trained in emotional awareness and expression therapy, and a mindfulness teacher and mentor. She guides individuals with chronic conditions and pain toward feeling better, reducing their symptoms, and eliminating symptoms from a mind-body care model. She's so dedicated to this much needed work, as you're going to hear, and it is her heartfelt desire to really help those who are suffering and want to live life with joy and ease. We're going to start our conversation in just a minute. If you're interested, you can check out her website, which is drritawellness.com, and she's on Instagram at Rita Mindful Mentor. Welcome to the podcast, Rita.
Thank you so much for having me, and thank you for such a beautiful introduction and very humbly thank you.
Yes, I'm so excited that we have you here. I don't always get physicians, and that makes me really interested, especially when you come and talk to our audience of therapists. We work closely with other providers, and we're also going to talk about your expertise and knowledge of burnout with female physicians, and that will apply so much to my audience of therapists who experience burnout and first responders and helping professionals who experience burnout. But jumping ahead, let's start with an introduction to mind body medicine. How do you help us understand what mind body medicine is?
Yeah, I myself am always learning what mind-body medicine is, but the best way that I think of it, it's saying that it's a condition or an illness or symptoms. It's not that it's all in your body, but it's also not all in your head. It's really understanding that interaction between that mind-body space and realizing that the mind-body are two poles of the same side of a coin. So it's really understanding that interaction, that we aren't isolated in just our physical, which unfortunately traditional medicine, the Western model, has gotten so physically oriented. And, when we go back to our traditional wisdoms, which integrative medicine encompasses, because it really talks about looking at the best of all medicine, Western medicine, and whole health healing systems like Ayurveda and traditional Chinese medicine. So it's really about kind of a relearning that that we are a whole person, right? We're not just our emotions and we're not just our physical ailments, and looking at that as a whole process. So it's really exciting that our science is catching up to mind body medicine now too. As you probably know, a lot of the literature out there is supporting that our emotions impact our well-being and our physical health, and people have better healing outcomes. Chronic disease is also an important whole, person approach. So it's a lot more than that, and we can talk about it for hours, but that's kind of a good a little overview for now.
Yes, yes, that's really helpful. For your experience, then, how did you start to shift or incorporate more of the mind body care approach from beginning as a traditional physician in Western medicine?
Yeah, thank you for asking that question, because over the years, I have seen so many patients, right? I have a high volume, I would see up to 500 patients a week. And these
Wow.
are, you're just always on the go, and of course, some people I knew and I had a relationship with, which was the beauty of being a family physician that I loved. But I saw patterns, I saw patterns of symptoms, I saw patterns of healing outcomes. And, over time, I really developed this intuition, which, kind of, as you know, as a therapist, and I'm sure
Yeah.
with your conditions, you see, you get this sense of the person and what they're going through. But what really frustrated me was, I would run all the tests, I would get all the, diagnostics, whether it's imaging or lab tests, or I would even send them to a specialist, more than one specialist. And they would come back still feeling frustrated and disappointed and kind of isolated because nothing was really solving their situation. There was no answers. And it
Hmm.
was very invalidating as well. And it was really until I had my own healing journey and in my own family, my father had a really bad, debilitating stroke.
Oh gosh.
Yeah, and it really was very hard.
Mm.
He has now passed away, but that
I'm
in my
sorry.
own
Yeah.
health issues and just being under the stress of that situation and compounded by being a physician and a mom, and we had other life stressors moving, and you know how that goes. As
Yeah.
a woman, we tend to have a lot of things always going on. It,
Exactly.
it,
You
it
carry
yeah,
the whole load.
yes, exactly. We
Right.
carry the whole load, but oftenly very silently.
Hmm.
And then of course add the people pleasing and the perfectionism and just being in the healing profession, I think we put a lot of pressure on ourselves
Hmm.
because
Yeah.
we want to be there for others.
Exactly. That helper's heart is really right there. But I think it's so refreshing to also hear a physician talking about some of these other moves that we make that contribute to our wellness, like people pleasing and, n not having the best boundaries and things like that. So, yeah, I'm loving this conversation already. Yeah.
It is like, I mean, it's so comforting to be with other like-minded and like-hearted
Hmm.
individuals. But just to sum it up, so I saw this pattern and I realized even for my own life, there's got to be more out there than just the physical. Like and I knew it intuitively. And a
Hmm.
lot of times I found myself, realizing that I was helping patients and more so not with my medical knowledge, but really just by my presence, by
Mm,
offering them that therapeutic presence of with the intention of healing, and
right.
it's like that loving presence. And it really brought me into the field of integrative medicine. I always knew I wanted to study it because I trained at Mayo Clinic in Arizona, and the Dr. Andrew Weil program is in
Oh,
Tucson.
wow.
So
Oh,
I always
wow.
knew about it, and I was like, "Oh, one day I'm gonna do that program." It was pulling on me. So when I had the opportunity to do it, and then again with my experience in clinical practice, I was like, "I need to learn these tools and
Hmm.
have a framework." And it was such a good program. It was a 2-year program, and just being also again with like-minded, like-hearted clinicians, mostly physicians, but
Hmm.
also we had one dentist in our class and a nurse
Oh, wow.
practitioner. So it was great. It was great. But
That's
I can
amazing.
also talk about that. I think we
Right.
need a 10-hour podcast because keep going on and on. So I'll
Right.
stop.
We'll definitely have you back for the second part. So, how interesting. You trained at the Mayo Clinic, but then you really wanted to go to the Andrew Weil Institute, and you eventually did that. Cool. That's so great. What's an example as you talk about like integrative medicine and techniques that maybe we don't really know about? Like, I love how you're describing, being so heart-centered and bringing your presence of healing and intuition into the room with your client. And then what follows with you in terms of like the integrative medicine?
I think integrative medicine is really about understanding there's no one way for
Hmm.
healing. And everybody's healing can be unique, just as everyone's nervous system is unique and how we process emotions or what our past experiences are. So the mind body gateway is the way I like to say it is there's no one approach. So integrative medicine really offered us the study of all wisdoms, ancient wisdoms, and then even practices such as using maybe hypnosis, even, or guided imagery, or using gentle movements like Tai Chi yoga, of course, meditation. So it's not just one unique pathway, but it really got me further on into because of my own history and my dad's stroke into more into the neuroplasticity of
Mm.
health and epigenetics and understanding the chronic stress response and how that impacts chronic disease and chronic illness. So it really got me down that work into looking at neural reprocessing therapy and how the brain can get sensitized or
Mhm.
primed by prior traumas or experiences or even prior illnesses, and that in turn affects our experience of pain, which is really interesting, but it is all from the brain. I mean, pain is
Mhm.
generated in the brain. So it kind of just unlocked a lot of doors for me, and it made me realize that if we can understand this, suffering can not be, sometimes we think, oh, you're in a lot of pain, you have to suffer. Maybe the suffering can be reduced or it can be even optional.
Yeah. Yeah. That brings so much hope to the field and to the people we work with. Um, as you start talking about the neural reprocessing, I know a lot of therapists are going to be really interested in that because many of us use different trauma approaches like EMDR, brain spotting. I've studied with Monique Hoving, who teaches trauma therapy called TRIP, Trauma Reintegration Integration Processing, which works one eye at a time, which is really quite fascinating from a brain science perspective. So, share a little like how do you conceptualize this neural reprocessing, and what would you actually do with a patient?
Yeah, and a lot of these therapies, just to also keep it humble, is they're built on other therapies, and
Hmm.
sometimes they're therapies that are probably integrate a lot of other modalities, so it's definitely not something new. It's
Yeah.
just a different way to look at it. But I think a lot of it is really understanding that so much of our embedded beliefs are in our unconscious, and what is in our conscious awareness is so limited. I mean, some people say it's 5%, some people say it's 10%, but it's really about bringing this out to our awareness. I mean, it's really like mindfulness is really awareness.
Mm-hmm.
And I think that so much of this work is really education. I mean, one of the pioneers of this work is Dr. John Sarno, and he was a PM&R doctor, physiotherapist. I can't say that word as well, but the
Oh.
other way to say it. But his ideas were very revolutionary in that he really felt like people's pain was due to repressed emotions, especially anger and rage,
Mm-hmm.
and they didn't have that ability to process it because it was safer to feel pain, physical pain, than sometimes to turn towards those difficult emotions. And that could be from messages we got from, that anger is not, you
Right.
don't express anger, or especially as women. I
Mm-hmm.
I mean, me as a minority woman, I mean, I really was never, I was taught to be the kind, calm,
Yeah.
obedient, think of others type of perspective, like many of us.
Right.
So I think a lot of this work is about bringing things to the surface, but
Mm-hmm.
in a safe way, and also adding some joy to that. I mean, a lot of times when we're in a positive emotional state, and let's say we do have physical pain, our reaction to that pain is going to be less. We're going to be less likely to like want to fight it, be frustrated with it, fix it, because we're going to be able to hold all of it.
Oh, 100% when we're in a positive state. And also, there's been evidence that when we're in a in a healthy, connected relationship that can also reduce the experience of intensity of pain. But I love, Rita, what you were saying about the somatic symptoms and the pain and how, like, the anger, the rage, that emotion could really get locked in the body and express itself in the physiology in a form of pain or a somatic symptom. And from a trauma perspective, often we'll look at that as that symptom developed because it was protecting the individual, it was protecting them from experiencing that the suffering of the emotions in an unsafe way, right? But if you can create a situation, your physician patient relationship where you create that safety for them, then maybe the expression would happen and some of the somatic symptom might start to lift or reduce.
Yes, absolutely. And I've actually seen it happen and it's so powerful. I've trained in again, this is founded on other therapies, but emotional expression and release. EA is called emotional awareness and expression therapy, EAET. And it's founded on parts work as well.
Oh, love it. Yeah.
Yeah, the part of this thing is when people feel comfortable and safe and justified, because a lot of times we feel like we have to push the anger down because we feel so much guilt, but it's like a healthy guilt. I mean, it's not.
Hmm.
I mean, I guess actually reverse that. It's an unhealthy guilt that, it's not justified because we're not doing anything wrong. Like the anger is valid. But I've noticed that through this EAT, once the anger is kind of like a dormant volcano, once it's in a safe way, of course, it's in your imagination, not anything real or
Hmm.
outwardly. But when you're able to process and release the anger, then of course the guilt comes. But then with the guilt, you get the sadness and then the self-compassion. And it's really helps to kind of process these difficult emotions. And then the symptoms actually do reduce or even disappear. There was a
Hmm.
study that showed that EAET was even more helpful than cognitive behavioral therapy for fibromyalgia patients.
Oh, wow. I believe that. That's fascinating. Remind us, what is EAAT again? This is new
Yeah,
for me.
it's kind of there's a lot of three letter acronyms
Yeah.
for therapies out there, but this one is a four one, but it's a emotional awareness and expression therapy.
Wow, that's fascinating. And so you've actually seen some patients really have tremendous results by doing this.
Yeah, and sometimes it's to the surprise of the patient
Mhm.
too, because this
Can you
doesn't.
share something like maybe anonymously, like or an eclectic example?
Yeah, I mean, I think, I can even share myself.
Okay.
This is maybe a more on a minor scale, but I had a without getting too detailed in case somebody watches this podcast and will know who I'm talking about. But
Yeah.
I had a situation where someone close to me was very heated in their
Mhm.
views, and they didn't have any, they were so emotional about it that they didn't have any way to, leave the door open for my views. And
Hmm.
I noticed like as they were talking, my heart rate was, my heart was pounding in my chest and I could feel the blood flow to my head and I was just really uncomfortable. And I felt a lot of anger at that moment. And I think that my normal response would have been to just, you know, say, okay, well, your anger is wrong.
Hmm.
Don't, you know,
Right. You were trained to suppress your anger also as a woman in your culture.
exactly. Like it
Hmm.
was not, acceptable. And then I would do self-critical talk, right? I would be like, oh, why are you so reactive? It's just, she's just expressing her views. Why did it bother you so much? You're the problem, get over
Hmm.
it. But instead, I just made space for that anger. And I just said, okay, I labeled it. I said,
Hmm.
I'm angry.
Yeah.
And then I said, I kind of just put my hand on my heart because that's kind of my chest areas where that tightness kind of comes in. And then I just said, I see you, anger.
Hmm.
And I that a lot gave it some space to be
Yeah.
there, to accept it, because I think when we accept an emotion, we're also loving it. We're also letting it be what it is without trying to change it. And then I did some deep breath work to kind of integrate it because I think that's part of the processing of the emotion. But then when it was, I was alone and I was in a safe place, I just kind of, I mean, I'm just going to be transparent here. I
Mhm.
just had some really angry feelings
Yeah.
like how dare she and who is she? And I was just like, almost like pushing her in my mind, and just like some angry emotions come up, and I just like went with it.
Hmm.
And
Right.
and what was interesting was, and I didn't even expect this outcome. The next day, I was able to let it go without
Wow.
having to force it or try it. I had and some new insights came in that,
Mhm.
you know what? People are like saying what they're saying, but they're not doing it against me. Like
Mhm.
that's about her. It's like it made space to like have a more authentic relationship and
Mhm.
made it less about me, but I just needed to process the anger.
Yes. Oh, Rita, thank you so much for sharing that vulnerable example because you let us into your world and your process. And I know so many of us can relate to that, but I loved the way you just described step by step what you did. And any therapist who's listening who does, IFS or even some parts work will hear how beautifully you did that, right? By acknowledging the anger, making space for that part, um, welcoming it with some compassion, breathing into it, and then, really spending that time also like validating it. I've in my work, and I work a lot with couples too, who get angry for very good reasons. That's one of the very first things we do is really validate the reality of their anger. Nobody ever gets angry without, for the most part, like without a really good reason, but we don't know what's underneath that. So we want to start looking at that. Um, and then I love that it also like added to the naming of it and like the integration of this part of anger for you and then dissipated more.
Yeah. No, I love how you like
Mhm.
summarized it, but yeah, I mean, it is a powerful technique, and it's
Mhm.
available to all of us. And what I love about these tools is that they don't require us to buy anything, or we always think we have some deficiency that we need to buy this or do this. I mean, of course, to work with a trained
Mhm.
practitioner, I do think we could definitely do this work on our own too. And some people read a book or listen to a podcast and they get the light bulb, just because it's a shift of attitude and perception,
Yes.
really. It's changing the brain. But, some of us do need that co-regulation and support. And
Mhm.
then also, if we have someone who's like-minded and like-hearted, why not do it with somebody who can help us through it? But yes, it is very
Mhm.
powerful, simple, not
Yeah.
rocket science, but
Yes.
it's not intuitive either sometimes.
Right. Right. And I love the idea of being able to do it with somebody and have that co-regulation. And usually that tends to speed up the process, again, because it's in relationship with somebody else. Yeah. So as you're talking about this, just thinking of somebody right now, we're recording this in December, so there's a lot of holiday stress and end of year stress and pressures. Is there something you could recommend, even just for the individual who's just feeling overwhelmed right now from this beautiful mind body care model?
The simplest thing I can think of is really just dropping into the body and
Mhm.
checking in with how you're feeling. And sometimes it's not simple to do that, but a lot of times when we're overwhelmed, we get into overanalysis where we have a lot of thoughts running through our heads, and we really don't.
Overthinking.
Yes. So we don't really know like how our body is doing. And sometimes it can be as simple as just like checking in and realizing, wow, my shoulders are like so tensed up.
Yeah.
or maybe it's just noticing like, gee, I'm like walking like with my posture kind of hunched
Mhm.
in, or maybe I need to just take a deeper breath and activate that diaphragm so my vagus nerve and my parasympathetic response can kick in. It's just that check in.
Yeah.
One thing I love is through Kristen Neff's work is
Hmm.
the self-compassion break, where she kind of ties in the three components of self-compassion, which again I think we'd have to go into it a little more detail, but really that mindfulness piece, like, okay, this is what I'm observing now without any judgment or kind of analysis. And then looking at, well, this is really hard right now, like giving yourself like that compassion, maybe a hand over your heart. Or I
Mhm.
like this too, where you kind of give yourself that hug to kind of,
Oh, I like that.
so
Put
you
your,
put one
so,
arm here, like under your arm, and then one,
okay, right,
and then you
right. So if
really
you're
feel like you're
listening,
holding.
yeah,
Yeah.
put one
Love
arm
that.
underneath your arm and the other over your shoulder, and you
Yeah.
can give a hug that way, a self hug. Hmm.
And then you get that oxytocin, which is the bonding love hormone. You could do that. Sometimes it's like a pattern interrupter too, like, because if you're in this zone where you're like doing, and then you just need to like kind of break that. Or sometimes it's just putting your feet on the ground, feel the soles of your feet on the ground. And then the third piece of the self-compassion is the common humanity. And I don't know, this one really helps me a lot too, is to realize like other people are suffering too, and really like kind of maybe saying a collective, if you want to call it a prayer or wish, or just a collective to ease the suffering for all of us. And then
Oh, I
just,
love that. Right.
yeah, so it just creates that connection. And
Mhm.
sometimes it's very isolating to just live in our heads.
Right. So that's beautiful. I don't think I was aware of that. That third one, calming humanity, is that what you called it?
Common humanity, just that
Mhm.
the thread of that part of suffering is part of the human condition. I mean, we all suffer. I love the Buddha has a quote that life is 50,000 sorrows and 50,000 joys. Like it's all of
Mhm.
it. It's like having that capacity to hold all of it. And maybe part of this work is just increasing that capacity,
Yeah.
because that's when we can have both, and we can really appreciate the joys and the sorrows, because the
Hmm.
contrast.
Yeah. Thank you for that. It's so beautiful. I still cannot believe, I'm talking to a physician who is sharing from this level about self-compassion and Dr. Kristen Neff. Like it's so great. It's so refreshing. Um, and I love that also looking beyond ourselves as an individual. And I think sometimes in our current society, we don't do that enough. Certainly could help. Our collective could use some calming right now. So any of those, you know, spiritual send outs that people want to do would be amazing. I love that other prayer, like that four tenets one, may be safe, maybe, do you know which one I mean? Maybe safe,
The
maybe
loving kindness
loving
is that,
kindness.
yeah, me too. Like Sharon Salzberg's work is so
Yes.
beautiful. Yeah.
Yeah. Yeah.
May I be healthy, and then you say it for the other, may you be healthy, may you have peace.
Hmm. Yeah. Yeah. And when we're giving from our heart, that opens us up even a little bit. So taking something outward like that with a calming humanity is really beautiful.
Yeah, I love how you said the opening of the heart, because I believe in the heart's intelligence as well. Like
Hmm.
you know, I know there's the Heart Math Institute that does a lot of research on the intuitiveness of the heart, and we're learning more about through neurocardiology just how involved the heart's sending messages to our brain as well.
Yeah, yeah. And I want to go back to something you said because it's so relevant about how so often we're not even aware of our bodies. We're not aware of what's happening in our body. Um, we might have had like a twinge of a headache at the beginning of the morning, and then next thing you know, you have like this big, huge headache. But really, it was happening earlier. Or like, for example, the other day. like at night I realized I had all this knee pain. I'm like, what's happening? I just went for a run this morning. Everything was fine, but I didn't put together that I was like really tense. It was cold, like the whole thing, and that I was completely unaware of what was going on in my body. Like that was probably a really big example. It's better now, but I go completely unaware of my body often.
Yeah, I mean, it's really like hard sometimes to see the where it's, the starting point was. And that's why mind
Mhm.
body medicine to me is gonna like shift the paradigm of conventional medicine
Mm,
because our current model is always looking at disease once it's already there, right? The pain is
yeah.
already there. They call it sick care, right? We're trying to
Mhm.
put out the fire that's already, but preventative care is really like having that awareness and sometimes we can catch things earlier, like maybe your knee was fatigued from the run, or maybe just need, from a traditional Chinese perspective, could have been like, oh, well, maybe you need to add some warmth to your knee. Like sometimes they
Mhm.
have this philosophy, and I may not be speaking
Mm,
fully to it, but I've learned about
right.
this wind cold, like, they say, oh, well, you may need to cover your neck. I believe in those things. I mean,
Mm,
I grew up,
yeah.
I was born in the US, but I grew up to Indian parents. I remember my mom would tell me things that were just seemed like kind of woo-woo, but now that I understand,
Yeah.
Ayurveda, I was like, oh yeah, I really shouldn't take a hot shower right after I ate a big meal because then all my blood flow, is not going to my stomach. It's going, I'm vasodilating and
Right.
not getting my my proper digestion. So these
Yeah.
these things like do play a role.
Yeah. And that's such a great example of the interconnectedness between the medicine and the Ayurveda and how they really do complement each other that way. That's so cool. So another thing that you help your clients with or people who want to work with you and in this wellness is from so many different aspects of integrative medicine. It could include Ayurveda, it could include some Chinese medicine and this amazing neural reprocessing.
Yeah, I mean, I have so many things that I've added on into my toolkit, and it's through my experience and kind of the integration of all these learnings and really that intuitive sense, which
Hmm.
honestly, in over the years, that has been probably my superpower is just, with experience and time and learning and personal and patience and life,
Hmm.
it's really what I feel like I can add a difference and help people and just raise awareness because for some people it's really just taking that to the conscious and bringing it into awareness because when you make those linkages
Hmm.
your brain just naturally will change. It's not something you have to force,
Right.
it just happens.
And
And that's
that's the neuroplasticity too, the
Mhm.
beauty of the science there. Yeah.
Yeah, definitely.
Rita, I don't want us to miss out on talking about the book you wrote on female physicians with burnout and kind of what you learned about that and what you can share with us about burnout. That's a huge topic, I know. So wherever you want to start with that.
Yeah, and I want to just say I contributed to the book. It was 50 physicians, I believe, or 52 if I'm not mistaken, but we one of our mentors, Dr. Sharon McLaughlin, she created this project for women physicians to contribute to their book, and it's their story, and
Oh,
no requirements or censoring. We just openly shared our story of our path and I
mhm.
think writing it was really part of the process of discovery is when you write. And I think
Yes.
that really opened the door for me to understand my own path of how I had a physical illness and then it led to my own burnout. But it really also made me realize how much I blamed myself for my burnout and how I felt that self-critic of like, oh, well,
Mhm.
you're supposed to be top notch. You're not supposed to have, any weaknesses or deficiencies. And then um, I think what it also made me realize is that burnout is because we care too much. You know,
Mm.
we care so much. We want to do a good job. We want to take care of people. But sometimes we forget that we also need to take care of ourselves.
Yeah.
And I think raising again the awareness of that topic is so important. And again, as a therapist for you, I think it really makes us examine what our core beliefs are about the world, about ourselves, and what are the messages we got that form those core beliefs so that
Mhm.
we realize that those beliefs are just things that got handed to us in a way too.
Exactly. Sometimes it's passed down, like you were saying. It can be a cultural or a generational type of expectation that's handed down for many, many years to families and their kids. Um,
Yeah, no, definitely. And it's not
mhm,
just a conversation about burnout. I think you could fill in the blank for chronic illness, chronic pain,
mhm.
suffering, like any type of situation when there's an injustice and our body, like you said, the anger is justified and it's a healthy emotion because there's an injustice happening. There's some
Right.
injustice and that's why we're feeling the anger. So for me, burnout was really a kind of a door opening to this path because that's where
Mm.
it was almost like, Rumi's quote where they say the light enters the wound.
Oh,
That
yes.
really helped me kind of find this work and path um, and my advice to everyone is to not blame themselves, but it's something you can't just say, cerebrally or in your mind. It's a process. It's an integration process, like what we talked about with the working through the anger. Uh,
Yeah.
but I was really grateful to have had the opportunity to share my story, and I
Mhm.
encourage everyone to do that, whether it's writing a letter to yourself that you're, not going to ever have anyone read, or if there's somebody you're having an issue with, and I'm sure you encourage people to do this in your work, but getting that story out there
Mhm.
because we all matter and we all deserve to be heard.
Mm. Right. And we have to have that safe way to get the story out there with safe people or knowing that we don't have to share it, but even externalizing it can be helpful. Um, it's really so needed. And I think what happens so much is the self-criticism and the self-blame just takes over. We don't even think we're worth like telling our story. And to think that there's a book of what did you say, 50 female physicians who shared their burnout story? Wow, that's huge. We'll link to everything, of course, in the show notes, but that's amazing. And imagine how validating that would be for somebody who, for instance, maybe I'm sitting here thinking, yes, I've been burnt out, but I can't imagine somebody's experienced burnout the same way. And then to see, all of a sudden there's this kinship, right, with other people.
Yeah, no, it was very empowering. And I think it
Mhm.
also helped me realize that my experience, I wasn't alone in my experience, which you would think being in a profession where we talk to people all day, it can get pretty lonely because you're just in a different set, you're there to help someone else. So it's like, the day goes so fast that you don't really
Mhm.
have a lot of time for, interaction with your peers or, you know,
Right.
people that, it's just a different connection, right?
Yeah. 500 patients a week, and it can get lonely because you're just serving them. You're kind of isolated. You're not getting care back. And that is, over helping, which is like the incipient of burnout.
Yeah. And I have to correct myself. I meant 500 patients a month.
A
Sorry.
month. Okay.
Yeah,
That's
sorry. Yeah.
it's
I was
still a
real,
lot.
yeah, I was like, wait a minute.
Okay.
I
Yeah.
misspoke. My apologies.
Yeah. There's
But
only
and
4 weeks in a month. That's still a lot of patients a day. So
about
we
125 a week. Yeah.
125 a week. Yeah. And I mean, I've heard from physicians here, who I've seen as clients or whatever. It's just untenable, the expectations. And we have that similarly with therapists and social workers who work in agencies. It's also hard to meet the needs. So a therapist like myself, could easily get burnt out by just taking on more clients because there's such a huge need in our caring hearts. That really creates a lot. Um, in terms of the system, like the healthcare system, this is another passion of yours. What do you think needs to change, or what could the healthcare system do differently to help reduce the burnout in the first place?
I'm glad you went with that question because I wanted to add in that the reason why, bringing this out into the awareness and letting us feel justified for our anger and for our feelings and is really that self-compassion piece because when we can have compassion for what we're going through, we can turn towards the discomfort because we think self-compassion means, oh, we're just gonna like have pity for ourselves. No, it's actually very empowering because then we can give ourselves a voice. And
Mhm.
I think what happens in medicine, and this starts even with our training, and it's, I really love my residency, but there was a culture in medical training that, and in my, the job I left was, you just put your head down, you do your work, you don't complain, you serve as many people as you can, and you ignore yourself, you suppress yourself in the process. And now healthcare is understanding with the shortage of primary care physicians or people want to go into specialties now and shortage of health practitioners, therapists, social workers. That model is not going to work for the future.
Mhm.
So for me, I think it's really about empowering each one of us because collectively we do have a voice, and I think because we've been so trying to fit into what the structure calls for and then blaming ourselves because we're always, we're high achievers, we want to do a good job, we want to please other people. It's all those personality traits that drive us into the profession to begin with, you know,
Mhm.
then
Right.
kind of work against us too. It's almost like I know they're not doing it on purpose, but they know the psychology. They know our psychology.
Mhm. Yeah, exactly. Right. We can be such good candidates for that. And to just put your head down and compartmentalize. And then over time, that compartmentalization is going to sneak out as some kind of somatic symptom or chronic illness or something else. Inevitably, I'm sure you see that. And I think we also saw so much of this happen during the pandemic, where a lot of frontline workers were just so completely overworked and burnt out that many people decided to leave the field too. And that added another gap to like the primary care pool.
Yeah, definitely. And I don't know if I should say this out loud, but I know even a few people, like I saw posts on private Facebook groups for physician communities that took their lives, like
Mm,
from that
yeah,
pandemic. I mean, it was really, you know, it was
yeah.
really hard. It was
Yeah,
really hard.
very hard. It's an unfortunate example of the lack of support and resources to the healthcare professionals and frontline workers. And, and that would include anybody who's also on the front line in a service role, thinking teachers and so on.
Yeah, for sure.
Hmm.
Mean, I think that the healthcare system is broken. And, you know, I felt like doing the integrated medicine fellowship really helped me validate that because another thing too is when you work in a certain model of care and you think you're the issue and not everyone else, or you think everyone else is managing, but you're not, you forget that there's other perspectives out there. And maybe someone would be listening and they don't agree, and that's totally fine. And they can have another perspective as well. But I think sometimes it's understanding that our perspectives are valuable and that is our experience, and no one can judge that or
Yeah.
because it's our unique experience. But I believe that a lot of people feel that the healthcare system needs to change. But I think
Hmm.
we can do it collectively, if we have a voice
Yeah. Yeah.
together.
And Rita, I love how you make it possible for people by sharing, by coming on this podcast, by your Instagram where, you come on and you do some clips there and it's so great. I love that you're giving people another option. They get to hear you and your philosophy and how you work with pain and illness and all of these other conditions that we have from a different perspective. And so somebody who is like, oh, I've seen all of these specialists or I've done all of this and I still have XYZ. I think you really bring hope because even as you described some of this emotional awareness and expression therapy, like that can be so so new. So, most people haven't tried something like that in combination with the integrative medicine. And so it just seems so hopeful. I love that you're putting yourself out there. Most physicians don't do that. And you are starting to do that. So everybody needs to follow Dr. Rita, um, for sure. But I'm thrilled with our conversation today. And I'm wondering, is there something else you'd want listeners to take away in terms of like practicing one small thing toward more wellness? Like,
Yeah, I mean, thank you for saying all that. It just warms my heart the way
oh,
you said everything, and
it's true.
it feels like a calling to do this work. I know
Mhm.
it sounds a little cliche but it really does. Like I just feel so compelled to share because it's helped me and I know it's helped many others and I want people to know that they matter and their
Mhm.
symptoms are real. Like this is not
Oh,
in any way saying their symptoms are not real because they're 100% real and they're felt in the body, but they just need a whole person
mhm.
perspective. Um, I would say that the one thing it's kind of a little bit more it's kind of like the self-compassion break, but it's another
Mhm.
tool I learned in my self-compassion training is the stop technique,
Oh,
which is really just a quick check-in during the day. And I like to use it between patients sometimes when you're like in a busy situation, you have like, one person asking you one thing, you just left a patient room or you just had an encounter, you're thinking about the next thing.
yeah.
But it's just to stop and check in with yourself. So S is, of course, stop. And I sometimes have to reread it over for myself. So I'll just, if you don't mind.
No, that's great.
Sure.
I'm always looking for things like this, and the simpler the better. So we can also make sure that we include it in the show notes too. The
Yeah.
stop technique.
I believe T is for timeout, but I just want to make sure I don't butcher it because I do it so intuitively now that I just don't like have the
Yeah.
formal words around it. But so stop is of course stop. So you want to whatever you're doing, you want to interrupt. So basically our unconscious mind is on autopilot mode. And that's where we're just like when your knee was hurting, you were like in your head and you were not in your
Right.
body.
Completely autopilot. Yeah.
So that's to kind of say, wait a minute. So get out of autopilot. And then T is to take a breath. So the breath is really the one
Hmm.
thing that's in our conscious awareness and also in our unconscious awareness, right? So we can direct the breath and we can connect our mind and our body through the breath. And of course, activate the vagus nerve. Observe, so just internally to like do a quick body scan. If it feels too much to do like as you do this more, you get used to doing it. But usually I tend to, these are the most common places people
Hmm.
feel kind of blocked.
In
Their
your
throat
throat.
chakra and then their
Mhm.
heart area.
Okay.
Sometimes the solar plexus as well. And you just kind of notice the sensations. And this is part of neural processing therapy too, is just notice with curiosity, like a mindfulness, perspective, like, what's going on? No judgment. You don't need to fix it.
Hmm.
You're not trying to analyze it. Just notice it. And then proceed is then, think about, what your next action is going to be, but be intentional about it. Like just think about what you want to do, one thing you want to do next, but just be like focused on that one thing.
Hmm.
So it's
Hmm.
called the stop technique.
Oh, That's great. Thank you for sharing that with us. I love it. I think we can definitely try it. Also, we can share it with our clients, which is really good too. But of course, we want to practice it first ourselves. That's the best way, and for it to become intuitive, just like it has for you.
Yeah,
Yeah.
it will. It doesn't take a
Hmm.
lot. And sometimes you just want to maybe put it on the notes of your phone, which is what I do, or even put it like on your laptop, like a sticky
Hmm.
note, because when we get in autopilot mode, it's really hard to break that momentum sometimes.
Yeah, yeah, exactly. So, for anyone listening who might want to connect with you or work with you, Rita, or access your resources, let us know about all of that.
Yeah, you can reach me through my website. There's a contact me form, and you're welcome to do that there. Also on Instagram, you can direct message me in the messages section. I'm
Mhm.
also on the directory of the pain reprocessing therapy website, Freedom from Chronic Pain, and also on the Symptomatic Me, which has a wealth of resources on mind body pain and neuroplastic symptoms. So there's a lot of resources out there if you'd like to learn more just in general.
Yeah, great. We'll definitely want to make sure we add those links to the show notes. And then you're at drritawellness.com, which is your website, and on Instagram at ritamindfulmentor.com. I already know I want to learn more about the Ayurvedic. That seems like something that would be helpful for me. Um, so thank you so much for coming on here in your busy life and busy schedule and sharing your expertise and also like your wisdom with my listeners. It's so empowering and hopeful for us to meet somebody who is practicing from this holistic perspective and bringing together mind body care. It's really beautiful. I know most of the therapists who listen to this um, can be very interested in that because the brain can't exist separately, the heart can't exist separately, right? Our feelings, like it's all connected. So just super grateful for your time today.
I am as well. Thank you so much. And in gratitude to just you making space for me to be here is really special to me. And I hope you have a wonderful holiday season as well
Thank
in
you. You
2020.
too. Absolutely. And so, Dr. Rita Gupta, thank you so much for being here. And we hope everybody has great holidays if you're listening in December. And until next week, stay heart centered.
Bye, everyone.
Bye.